Hello, everyone. It's March 24th on Wednesday, and when we were here on Monday, over the weekend, I think we had I can't recall what it was, but maybe 12 deaths, and we were at the time surely mourning the 12 deaths, and if it was 12, I'm not sure exactly the number, but it surely wasn't a number like 80 or whatever, that was, jump out right at us and everything. But we're always cautious because over the weekend, sometimes we don't get stuff reported and everything, and then it carries on into Wednesday. And so on Wednesdays, we have that uptick. But today, I'm very pleased that we have 7 deaths to report, and so it's just another indication that things are moving the right way, and we just have to keep it up. We surely mourn the 7 deaths, and as is so true now for 2,619 great West Virginians. But we've got to keep moving. We've got to keep going north. We've got to keep trying in every way in the world to get past this, and all the indicators show that we're on our way. So just hang in there, West Virginia. We're not far, but please remember these great people in your prayers and your thoughts, and let them know, please let them know that they're not alone. Our 2,613th death is an 83-year-old male from Wood County. Our 2,614th death, an 89-year-old male from Cabell County. Our 2,615th death, let me step back. I don't know if I said this incorrectly, but our 2,614th death is an 89-year-old male from Cabell County. Our 2,615th death is a 69-year-old male from Barber County. Our 2,616th death is an 80-year-old male from Harrison County. Our 2,617th death is a 56-year-old female from Jefferson County. Our 2,618th death is a 76-year-old male from Kanawha County. Our 2,619th death is a 53-year-old male from Monroe County. Oh, me. Too young, too valuable, too much wisdom. Don't let them become a number, please. We have 389 new positive cases in the last 24 hours with a daily positivity rate of 4.01. Our cumulative percent of positive continues to fall. It's at 5.28. Our active cases are 5,581, and our recovered cases are 130,290. We've upticked as far as the number of people that are in the hospital. We're over 200 again, with 212. Our ICU units, have 73 people in those, and we have 1 red county in Jefferson County. I remind you again and again and again about if you're 65 years of age and older and you would, by chance, have any kind of symptoms whatsoever, please, or you're just anxious about what's going on, please go get a test. If we can catch this early, we can give you these antibodies and we can get rid of this thing and save your life. If we don't catch it early and you truly do have it, you're in for a tough road. That's all there is to it. We've got some announcements today that I want to run through pretty quickly here. That in regard to our summer camps, today I'm signing an executive order that will allow all summer camps to resume on May the 1st. And naturally, we expect these camps to follow all the safety guidelines to protect the people. I am also signing an executive order today that allows live music to resume effective at midnight tonight. And I will expect the same with all these events to follow the safety guidelines. They're all posted on the website. They're all out there. Also today, I am announcing that we are going to stop using our color code system for high schools in West Virginia. This system has been really valuable to us, and it has now gotten to the point in time where we have used this really valuable tool. It's been argumentative at times, but it has served us really well, really, really well. I thank all those that implemented and helped implement this plan. It really protected us in many ways and got us through this, but today, especially with all of our teachers and service personnel that are vaccinated, and all that wanted and accepted the vaccine, and that was a very high percentage. With that, really and truly, this map has outlived its time now, and we need to move forward and everything. So all West Virginia high schools will be open full-time unless there is a significant active outbreak that requires them to close. We'll always monitor, we'll watch as closely as we possibly can. Our health experts and everything, and our team will intervene anywhere and everywhere we have to and everything. But when we originally announced our color-coded map for our school openings, it was the best way that we could make sure that we're keeping our students and teachers safe and everything. It served us really well, and I'm very proud of all those that put it into place. But now it's time for it to go and retire and us move on. So again, I am very happy to be able to say all of our schools are open. They're open full time, and I really think that it's going to only make things better for a void that we had with our students and everything that we had to weather the storm, did we not? And if you just think about it, we've been blessed by not having outbreaks in our schools with our children and everything. But so with how we're moving forward and with the fact that we've got our teachers and our service personnel vaccinated, we're going to move forward with retiring our color-coded map. So if you flash it up there one more time, and I'm going to say bye to a great friend that saved a lot of lives. So dear friend, I'm going to pass you to the side, and we're going to move forward. Okay, from the standpoint of a vaccine strategy, and I'm sure Dr. Marsh and many others will talk to us about this, but we're going to now put up some real effort and focus on the fact that what we're seeing is that I guess the right word is the transmission rate. We're seeing transmission, not serious illness or death. We've seen that with the over 50, over 65, over 80 group, but we're seeing transmission, significant transmission occurring, with our younger people. And so we're going to make a real effort and everything to get, our younger people vaccinated, and the 16 to 29-year-old group, a lot of college students as well as high school students and whatever. We're going to make a real move on that. Dr. Marsh is going to talk to you about that, and and the value that's another West Virginia first move from the standpoint of really trying to cut this thing off at its knees. We've got it moving in the right direction as far as our elderly, and those are the people that get seriously ill and die. But we've absolutely got a transmission issue that we need to really jump back on and cut this thing off at its knees there. So we're moving forward with that. Dr. Marsh will talk more about that in just a few minutes. From the standpoint of our vaccine eligibility and pre-registration and all that kind of stuff, we want you to continue, pre-registering. We want you to know that we're not going to let our foot off the gas and leading the nation and getting our vaccines out there to everybody. We're now available to all West Virginians over the age of 16, and we're still prioritizing those of the elderly, and we're trying to get that number of 65 and plus well over 80%. We're already over 70. We want to just keep moving and get that well over 80, and my goal is 85% and that would be terrific. As far as the vaccine distribution update, we're at 97.9% of the first and second round doses, and that's all great stuff. To date, we have administered a total doses, get this, in West Virginia arms of 721,869 doses. Hats off to all those from our local health clinics to all those, the first responders, the National Guard, DHHR, great work, great work. As far as a manufacturers partnership, now get this, under my direction, the Joint Interagency Task Force is beginning partnerships with manufacturers and small businesses across West Virginia to facilitate clinics at their facilities and offices. So as of today, we have 10,000 doses that we're going to commit to this, to schedule this week to reach out and get even more people that may be, I don't know, for whatever the reason, they just have not gotten their vaccination and everything. And so we're going to go to the companies and we're going to set up with the companies and vaccinate their employees right there. Some of the companies that we've already partnered with on this first round include Toyota, Procter & Gamble, Pilgrim's Pride, Alliance Coal, and First Energy. And I want to thank these great businesses for stepping up and working with us and everything. And General Hoyer will tell you more about this initiative in just a second, but it's great stuff. Into saving our wisdom so far, the group that we moved so quickly on, and I keep going back because this is the moment right here when we really turned the tide and started saving tons of lives. We have now got in the arms of our elderly, 65 and older, 227,544 individuals have gotten a shot. 154,191 of them have gotten fully vaccinated with the second shot. We have now, this means that when you add up in the doses from our Veterans Administration and from the Federal Pharmacy Partnership with Walgreens, we are above 70% to all our 65 and older population. And like I said, I want to get it to 85. Now we've bumped the goal up to 80, but I want to get it to 85. And I keep encouraging everyone, if you're 65 years of age and older and everything, please try some way to contact us. We're going up every hollow. We're trying every way in the world to get everybody vaccinated. I've got some other things to report here. As far as the new move to have 3 regional clinics, they're going to be in Berkeley Springs, and they're going to be in these counties. They're going to be in Berkeley, Kanawha, and Monongahela counties. And if you're over the age of 65, all you've got to do is contact our hotline, and we will immediately get you in to get your shot. So all this wait list, all this stuff is now we're getting a number of vaccines that we can really move even faster. So if you're over the age of 65, all you've got to do, if you can get to one of these facilities in Berkeley, Kanawha, or Monongahela counties, just call us. Just call us in some way, somehow. Immediately, we will get you in and get your shot. From the standpoint of all West Virginians age 16 and older, pre-register, go online. If you can't go online, if you'll contact us, we'll walk you through it and everything, get you pre-registered. All the stuff on the vaccine info hotline is up there and everything. Vaccine reminders, I've said it 1,000,000 times. Literally, come on, West Virginia. Just please, and you've done great. You've done great. Please quit listening to the noise. Please quit listening to people that are in your ear saying, if you take this vaccine, you're going to, in 3 months, who knows what they're saying, grow another arm or something crazy. At the end of the day, absolutely this vaccine is super safe, and it'll save your life. And if you don't get the vaccine, you're taking a heck of a risk. That's all there is to it. As far as taking advantage of our free testing, please do so. Again, thanks to Fruth and Walgreens, great work. I really appreciate all you did with our drive-through pharmacies and everything. And in our long-term care facilities and our churches, now these are numbers that are really low, but these are numbers that are starting to turn a little bit. Just like our hospitalizations, they've turned a little bit. Just like what's going on in many places across this nation, they're turning a little bit. We're still really rock solid in charge and everything, but things are turning a little bit to the negative. We have 2 outbreaks in our long-term care facilities. We're down to 1. We have 8 outbreaks in our churches in 6 counties. That's Braxton, Fayette, Webster, Monongalia, Raleigh, and Nicholas counties. And I think we were down to 1 there as well. We got to do better there, especially in our church community. If we don't watch out, this thing's going to jump up and grab us, and we don't want that to happen. From the corrections update, we have 33 inmate cases and 6 staff cases, and 25 of the inmate cases are at North Central, 3 at South Central, and 2 each at Western and Lakin. All the guidelines are up there as far as wearing your face covering and everything. You got to continue to do that for a little bit longer. Nobody likes it, I get that, but it doesn't matter, whether we like it or don't like it. I mean, really and truly, at the end of the day, this is your first line defense, and it'll save your life. And I urge everyone, if you have had the incredible blessing of getting COVID and making it through it, it seems to me like you at least owe consideration to go give blood. So please consider that. And that's all I've got right now. But the only last thing I'd end with is just imagine this. Imagine through time here, we've gotten vaccinated well over 700,000 people. Do you know how many tests we've done in West Virginia? We have a total population of 1,700,000 and a few. We have tested people in the state of West Virginia of 2,382,655 tests that we've done in West Virginia. We have done in the state of West Virginia the number of total tests. Now, many people have got many different tests, but we have done in the state of West Virginia approaching, and we're not quite there, but we're getting close. We're getting close to have done in the state of West Virginia 1.5 times the total number of people that are out there. We've done a test. It's amazing. It's amazing. You got a lot of people that have really worked and done great work, and I pray to God above, as you see them, you'll absolutely pass on all the appreciation in the world, because what jobs they've done, and I could never, ever thank them enough. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you and good morning. I am really very enthusiastic that the governor has moved in the direction for the state that he has, and we will. Let me just start off by saying that with our school personnel immunized, both at the teacher level and the service personnel, then I think it is absolutely the right move to retire the MAP and let our children go to school. With that said, we know that we are very much, as the governor has instructed us to, focused on saving lives and improving well-being and maintaining the capacity in our hospitals. And the way that we did that, as we've talked about many times during these briefs, is we've really focused on the people most likely to die and most likely to be hospitalized, which turns out to be residents of extended long-term care facilities, nursing homes, and our West Virginians who are older. Certainly, you know, the majority of people that have died in West Virginia have been over 70 years old. But if we look at 97% of people that have died, they've been over the age of 50 years old, which is a reason why we've really targeted and focused on this group of people, as well as, you know, people with pre-existing medical conditions, to be able to prioritize for vaccines. And we still want to maintain our discipline and commitment to do that. But West Virginia, like the rest of the world, is starting to face another great challenge as part of this pandemic. And so there's really two sides to this pandemic. We focused on the save lives and reduce hospitalization side, but there's also the spread of the infection side. And we know that in countries, we have the benefit of kind of getting a bit of a glimpse of the future as we look to Europe. We know that countries like Germany and Italy are really getting overrun with the variants of the virus, the United Kingdom variant particularly. And we're seeing that also happen in the state of Michigan right now. And so West Virginia is blessed to have, you know, great leadership and a wonderful citizenry, but also that we are a bit behind some of the other countries, as the United States is, but also some of the other larger states. And so what we are starting to see in West Virginia is the spread of the virus, which is really the key contributor to how, you know, to people getting sick in the state, but also the key issue with the variant viruses starting to grab hold and really grow in the state. And we know that our younger people, our 16 to 29-year-olds, are where the spread is taking place in West Virginia and other parts of our country and in the world. And we are starting to see those variant viruses grow in this younger population, particularly the California variants, which are the variants that can infect more easily and tend to be spread from people that are less symptomatic, don't have symptoms. But importantly, we're seeing more now spread of the United Kingdom variant in West Virginia. And that is a particularly concerning issue for us, because this variant is not only twice, 50% more transmittable, more infectious, more easy to infect people, but it also is about 50% more lethal. And as we're looking at our hospital numbers, as the governor said, we're seeing a larger increase in our 60 to 69-year-old part of our population, which is really why we want to vaccinate people over 50 with real discipline. But also we're starting to see a little bit of an increase in our 20 to 29-year-old group. And in Europe, we have started to see younger people get sicker with this variant virus. So for the reasons we want to reduce the spread, we're really still going to address the death and the hospitalizations, but now to start to reduce the spread, we really want to focus on this younger part of our population with the same discipline we've done and will do with the older part of our population and people with pre-existing medical conditions, but starting to focus on our high schoolers, 16 to 18-year-old group with the Pfizer vaccine, and particularly those high schoolers on sports teams, because we're starting to see spread in the schools. That's the most common place for outbreak. And this 2021, we're seeing the spread happen in students. We haven't seen in classroom spread with the safety guards we have there, but we're seeing on sports teams and between children and young adults to age 30, we're seeing more spread. And so therefore, we really want to target the high school population and the college student population. And we want to focus our vaccine strategies on reducing disease there, because these vaccines are really good at reducing spread, but also reducing the variant spread. So we can stop the variants, slow them down, so we can continue to vaccinate more of our citizens. We also want to make sure that when we're seeing these outbreaks, that we're very rapidly doing this genetic sequencing of the virus. And if we do find more variants, we are going to become more aggressive about mandating that those people who are close contacts of folks with the viral variants have a 14-day quarantine or isolation period. And the CDC says you can do a faster one, but we know the variants can stay around longer. So 14 days isolation, for people who are primary contacts of folks who have the variant viruses. And we'll do much more aggressive contact tracing in these groups as well, because we really want to isolate those people that can spread the variant viruses, because that's the way that we protect people in West Virginia, protect our younger people up to age 30, but also it buys us more time so that we can continue to vaccinate all of our citizens over 50. And we absolutely ask people to choose to take the vaccine, or people with those pre-existing medical conditions, or people who are in our essential worker category. And the other thing is we really also want to invite families to come together to get vaccinated, because ultimately protecting each person in the family is a real gift to other people that live with each other, but also for extended family members. So thank you very much.
All right, thank you, Dr. Marsh. Now let's go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As the governor and Dr. Marsh pointed out, we're opening up new fronts or parallel paths to get vaccines to the right places. If you look at this from a military construct, when you have the resources available, you open up multiple fronts against the enemy to deplete their capability. In this case, the virus is the enemy, and we're opening up multiple fronts to deplete its capabilities. So you've heard the governor talk about our initiatives with businesses ranging from retailers to manufacturers to coal companies to other energy companies. Also opening it up so family members can now be vaccinated with those individuals in these clinics that are set up. Again, we're not taking our eye off of the 65 and above and then the 50 and above population. And actually, as the governor has tasked us to set a new goal now to get to the 85% mark on that 65 and above population. We'll also be working, as we know from a West Virginia standpoint, in responding to emergencies. Churches tend to be our centers of gravity in the state of West Virginia for response. So working with BOAD and our various church denominations to make more available. We'll be also opening up opportunities for various other groups to get family members engaged in this. Next week, we have been given some baseline numbers that will again put us over 70,000 total vaccinations based on all the outlets, to include what we get centrally as well as federal pharmacy and FQHC programs. We are going to see an increase in the number of Pfizer doses available to us next week, which will be particularly important as we get to the younger population, knowing that Pfizer is the one vaccine that allows us to go down to the age of 16. So a lot of efforts going on within the Interagency Task Force with a number of partners. We'll also see a major movement with West Virginia University Medicine next week in 4 areas of the state, and that will be followed by additional hospital clinic support going forward to get to populations. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Hi, good afternoon. Just want to comment on a few things. I am sitting at the JIADA this afternoon, and I do want to thank everyone for all their hard work that they're doing here. We have a lot of people who work here on a daily basis, a lot of community health centers, but a lot of people who are stationed here daily. In follow-up to Paul Mullen's question, he did ask about our flu cases. We are seeing the lowest number of flu cases since 2005, actually, in the state of West Virginia. Normally in February and March, we see a heightened number of flu cases here in the state, but I think with all the mitigation efforts that we've been seeing with hand washing, social distancing, and of course mask wearing, that is why we are not seeing a lot of flu cases. So that's just in follow-up to the question that Paul posed the other day. In addition, Clay did mention the UK variant. We are seeing some cases in West Virginia. To date, we have approximately 24 cases that are spread throughout the state. We have seen that in approximately 9 counties as well. Those are in some of our bordering counties. Of course, West Virginia does have a lot of bordering counties, but that's also to remind people that when it's your time, the vaccine is available. Of course, the governor did, make it available to everyone in the state right now. So anyone 16 and older, Pfizer is available. So we encourage everyone to get vaccinated. It is very important, and also to wear your mask when you're out and about in crowded spaces. But that's all I have for today. Thanks, Jordan.
Thank you, Doctor. And finally, to Secretary Bill Crouch with the DHHR.
Morning, everyone. The governor mentioned long-term care outbreaks and where we are. We only have 2 outbreaks in nursing homes and assisted living right now, which is just phenomenal. I want to thank our partners throughout the state of West Virginia. We had a call with them early this morning. They are really tremendous leaders, and with the governor's leadership, which has just been focused on this population from day one, we have reached some great milestones in West Virginia. We were the first to test every nursing home resident in the state of West Virginia, the first state to do that. We're the first to vaccinate all individuals in long-term care and staff in long-term care, the first state to complete that process. We're the first to implement a vaccination maintenance program to make sure that new staff and new patients in nursing homes are vaccinated, and that we maintain those low rates out there. So I tell everyone it's the leadership in West Virginia and those partnerships that we have throughout the state that have really kept us on the forefront of this disease and allowed us to make decisions proactive rather than react to what's happening. With that, I want to remind folks that patients, residents in long-term care have gone many months without visitors and have many times been isolated for periods of time. The good news is on March 10th that the Center for Medicare and Medicaid, CMS, issued revised visitation guidance. Both nursing homes and assisted living residences are required to follow those guidelines. There are 9 core principles of infection control and safe visitation. Those include screening, hand hygiene, use of face covering or mask for visitors and residents, social distancing of at least 6 feet apart between persons, instructional signage, infection control precautions, cleaning and disinfecting of high-frequency touch surfaces and designated visitation areas after each visit. This guidance is posted on the COVID-19 website. We're so glad that this population who has been at highest risk for this, for COVID, for this disease, can now enjoy visiting with their families. So thank you very much.
All right, thank you, Secretary. We'll now go to questions from members of the media. The first today from Mark Cram with WDVM.
Well, good morning to everyone, and it is indeed good to hear Secretary Crouch mention that we've reached milestones. I think that's very evident. We're hearing, as far as members of the media here, fewer complaints about frustrations with vaccine distribution, which I think is also a notable, although there are still some individuals who are concerned about this. What I'm hearing more often now are individuals who are saying, I'm going to wait 6 months or a year or so just to kind of see what the possible long-term effects of this vaccine might be, any side effects and so forth. What's the possible impact of being able to overcome this? Does this prolong the efficiency as far as ending the pandemic with individuals who simply say, well, I think I'm going to wait 6 months or a year? Thank you so much.
Mark, let me answer it. Here's the straight answer. You know me, I don't blow smoke at anybody. I just tell it like it is and everything. What I would say to those people when they said that, I'd look right back at them and say, well, I hope you make it. I really hope you make it for 6 months or a year, because some of you won't. That's all there is to it. Some of you will end up, if there's a group of you and all of you are saying, well, we're going to wait 6 months to a year to just see how things go and what the long-term effects are, some of you are going to die. That's all there is to it. Some of you are not going to make it, you know, and I think that's very foolish. And I think it's, I understand, I get it, and I understand people's maybe hesitation and everything, but in this world, we've got to go with what our medical experts, the science, and everything is telling us all the time, you know, and they're telling us, you know, that there are some people that have had some adverse reactions to this, and they get a little bit feeling bad, and they get sick maybe for a little while and everything. But we don't hear that people that are taking this vaccine, you know, are growing antlers or dropping over dead or whatever like that. What we hear all the time is just this, you know, Moderna or Pfizer or whomever it may be, Johnson & Johnson comes out and they says, you know, this vaccine is 79% protective, but 100% protective against death and greatly protective against hospitalization. To those people that are saying that stuff, I pray that they'll make it. I just pray that they'll make it. Some won't.
All right, thank you, Mark. Next to Kenny Bass with WCHS and Fox 11.
Hi, I had a question directed to me that I couldn't answer, and perhaps it's been talked about on the briefing and I've just missed it, but it goes along the lines of that reports are that the state has received about 200,000 fewer vaccines than national data shows. The state has 200,000 less vaccine doses than national data shows we have. Plus, the state is saying that we've got a 97% administrative rate right now, but a couple of sources, Becker's Hospital Review, the New York Times, they moved that down to 77 to 82%, more of a middle of the pack number. Can General Hoyer or Secretary Crouch, I'm sure there's an explanation in there somewhere, probably about delay in reporting. Could you guys just address the differences in those numbers and when they do eventually sync up? Thank you.
General, I think you got to go more than anybody here.
Yes, sir, Governor. So, Kenny, we track the execution rate of the doses that we, the state of West Virginia, control centrally and have the ability to administer and have direct administration oversight of. There are the additional doses that go to entities under the federal pharmacy program. There are doses that go to the Veterans Administration, doses that go to the Federal Bureau of Prisons, doses that go to federally qualified health clinics that we don't have the ability to manage the execution of administration. So that's where you see both the difference in the total numbers as well as the difference in the execution rates. So those national entities are probably taking data from CDC, but again, we only have control over a central amount of doses, and that's what we manage our metric off of. And then, as the governor pointed out earlier, in order to get the total percentages over age 65, the actual percentages, we had to go out and query information from the Veterans Administration, from federal pharmacy programs. I want to thank Walgreens and Fruth and those partners that are participating in those programs, making data available to us that we were still attempting to get from the CDC. Thank you.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, could you clarify what you said about high schools? You know, I understand we're retiring the MAP, but you said schools would now operate full-time unless there's a significant outbreak. What exactly is defined as a significant outbreak, and who will get to make that call? Is it the individual school administrators? Is it on a county level? Thank you.
Charles, I guess who's going to make that call is the local health departments, but Dr. Marsh, you can answer this a lot better than I can.
Well, thank you, Charles. So we do have guidance that is directed from DHHR and our epidemiologists working in concert with local health departments, county health boards, and the Department of Education that identifies substantial outbreaks, which mean that we have documented COVID in a particular area of that school, and we then determine whether or not the exposure to others from that case, that person, is substantial enough that we need to either have a classroom be dismissed and isolated or quarantined, or more than a classroom. And as I said, because we're seeing more cases happening in schools, and those being congregate settings, that we are particularly focused at doing genetic sequencing of those samples so that we can define whether or not these are variant viruses, of which there's 5 types that the CDC recommends that we report today, which is the United Kingdom variant, the South African variant, the Brazilian variant, and 2 California variants. And so we will do that. And as we mentioned earlier, that if we do identify an outbreak that's caused by a variant virus, then we would require that all people that have meaningful contact, which is still right now from CDC 6 feet in a cumulative 24-hour period of 15 minutes or more, and that's with or without masks. Eventually the CDC hopefully will get to 3 feet versus 6 feet, but that's currently the guidance. Then we would have them be mandatorily quarantined for 14 days, because these variants can hang around longer. And the whole goal here is to protect the people who are involved with this and who may be exposed, but also to reduce the spread. And so we'll be very aggressive about contact tracing in these areas too. I don't know if you have any other comments you'd like to make.
Just additionally that it is, but the health departments with outbreaks, and then the schools nowadays are not being closed entirely. They are by classroom. If there's a outbreak in a classroom, they are just closing those classrooms. We don't see schools closing entirely as well. But to answer you to that, the health departments, the schools, the school boards themselves are, deciding that. But we don't see entire schools having to shut down either. They're just isolating the classrooms and investigating them aggressively with contact tracing. So that's why we're trying to move forward with the virus, because we want kids to be in school as much as possible. Thanks.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. As we have more people getting vaccinated, we're going to have more people that have those side effects for a day or so after the vaccine. Is there anything you can do to treat those side effects like acetaminophen or ibuprofen? And about how many people on a percentage basis do have some sort of reaction to getting the vaccine? Thank you.
Dr. Amjad, go please.
You're on mute,
Thanks, Clay. Paul, we prefer people to use Tylenol. If you do need to use something for pain, we try to avoid ibuprofen or NSAIDs because that can mute your body's immune response to the vaccine. But if you really need to take something, we prefer Tylenol or something like that for pain. If you don't need to take anything, we'd rather you not. But as far as side effects go, we do have some people complaining of minor, aches and pains or flu-like symptoms. But Tylenol would be the recommended thing to take. But you definitely want to speak with your doctor first to make sure you're not having any other medications that might interact with that. But if something minor, I would recommend, a Tylenol if that's the case. But thanks.
Come back to me, Jordan. And I have a recommendation. If you have any level of side effects and everything, small portions of hot fudge cake will make you feel better, and it'll get you through this.
All right, thank you, Paul. Next to Kimberly Keggy with WSAZ.
Hi, everyone. Happy Wednesday. I've had a few healthcare workers reach out to me. They received their first dose of their vaccine. They got Pfizer in February with Walgreens, but due to some scheduling conflicts, they haven't been able to get their second dose. So now they're several days past, 5 to 10 days, ranging past that second target date. So, Dr. Clay Marsh, I'd like to ask you, how long can people go without getting their vaccine on their target date, and how long is it safe for? Do they need to double vaccinate? And then Secretary Crouch mentioned last week there were still thousands on priority list that were in the registration system that hadn't received a first dose. Where are we at? And did the DHHR give county health departments those priority lists to help fast track that process? Thank you.
General, please, can you help us here, sir, or should I go to Secretary Crouch and Clay?
Secretary Crouch and Clay, Governor.
Okay. All right. If you guys will take it.
Yeah. Thank you, Governor. Yes, those lists are all pushed out to local health departments. We had folks contact, I think I mentioned, all of the individuals, the African-American population age 65 over on the list. We had 1,400 and some individuals. We got through that list a couple of days. A lot of folks are out and about, so it's difficult to contact everybody and get an answer in terms of whether they still want the vaccine or not. Most of those individuals on the list we're finding have already received the vaccine through Walgreens or their clinic, their FQHC, and other sources. We are happy with that. Again, the list was to try to make sure we get people on that list vaccinated as quickly as possible. We are now pushing out to 70 and over and calling those individuals. My understanding is the local health departments have already contacted the individuals that are 80 over on that list. So we're reducing that list quickly now. There is a way to now get an appointment for vaccination through vaccinatefinder.gov, a way to get a link to a pharmacy and have their own and utilize their online system to schedule an appointment. So we want people to do that. But we are reducing the list. We're calling people directly. We're looking at ways to do this faster. The governor directed us to not place people on lists any further. We're trying to get appointments for people when they call. So thank you for the question. We are moving those folks out and getting them off the list.
All right, thanks, Kimberly. Governor, I'll turn it back to you.
Well, I would just end up by just saying this. Through all this, no matter how good the medical experts have been, no matter how many good decisions that maybe that I've made or all the people around me have helped me make, you, West Virginia, have done it. You've done something that is absolutely the envy of the nation. Just to tell it like it is, network after network calls constantly wanting to know about West Virginia. All across the nation, if not all across the globe. I mean, it is totally unbelievable what you have done. I mean, if you just step back from it and think just for a second, this thing was coming to our shores, and it was coming in a wave like none of us could have ever imagined. You were the third oldest state and the most chronically ill state, and rated as the most vulnerable of all states, the most exposed. You could have gotten wiped out like nobody's business. And what did you do? You did exactly what West Virginians have done so many times. You stepped up. We stepped up to service all over the lands, all over the world, from the standpoint when we were called upon militarily. But you stepped up and you stayed together and you were smart. Absolutely. Did you not just do exactly that? Now, we can all sit here and be proud of what we've done, the medical teams and everybody else, all across the land. We can all do that. But at the end of the day, West Virginia, hold your head really high and be proud of yourselves. You are the ones that did this. You're the ones that stayed together. You're the ones that looked after one another, your families, your neighbors, all of your communities and everything. And at the end of the day, you have pitched numbers that nobody could have ever imagined how good you have been. By doing so, you made your mark again, as great West Virginians. There's nothing that anybody will ever be able to take that away from you. You know, my dad used to always say this. He'd say, Jimmy, in life, the only thing that nobody can take away from you is your education. And that was his way to keep me as dialed in as I could possibly be in schoolwork and everything. And I was anything except exceptional, But absolutely, in this situation, West Virginia, you have done something and you've put your mark down. Your mark down. Each and every one of you, I love you with all my soul. I thank you for all the goodness that you've done. I thank you for how you've protected one another. I thank you for how you have made the nation awaken again to just how great West Virginia is. God bless each and every one of you. Really proud of you.